Skincare and anti-aging can be an overwhelming topic with all the creams, lotions, and potions available on the market today. So today on In the Know, we decided to sit down with our guest expert, Shawn Solomon of the Thornhill Skin Clinic. She'll be talking about some of the lesser-known anti-aging tips for your 20s, 30s, and 40s, as well as looking at some of the most advanced procedures available today that can help you look years younger. Welcome to In the Know with Shawn Solomon. Shawn, thank you so much for being here. And this is really a hot topic, I think.
Definitely.
As I said before, it can be kind of confusing, though, because there are so many options available today for people.
No question. I mean, when it comes to anti-aging skincare, even good skin health, there are a million things on the market, and the marketing behind some of the products that you find in the drugstore versus Holt Renfrew or maybe in a medical spa have so many different impacts that you don't really know where to turn or how to pick something for yourself that's going to be effective.
Right. And so we are going to get into skincare for the 20s, 30s, and 40s, and they're also different.
Yeah, there's some things that are the same, but there are some things that change no different than we change as we age.
I think one of the other things, I mean, people are more interested in anti-aging than ever before, I think because of the way pop culture, social media, I mean, we're just out there on display.
We're a generation of, well, not so much you and I, but our kids and their kids are a generation of social media to a degree that it is the building of the self-portrait. It's the way that they see each other, and it's become an aging timeline, so to speak, because you can quickly look back at a picture from 2 weeks ago and be like, oh, I looked so good in that picture, and how come I don't look good today? And in fact, we have clients and patients walking into the clinic clutching their cell phones in their hand in a total panic, showing us pictures of themselves from 2-3 years ago, and specifically 20-something-year-old girls saying, really? My skin looked better and it was glowing more here, and I look at the pictures and I'm really trying to connect. And I'm like, but could it be that it was a better camera? Do you know
better
what I mean?
lighting?
But the end of the day is people are becoming harder on themselves, scrutinizing the individual imperfections far more than they ever were before. I mean, when you take the word and the term selfie, it was the 2013 Webster Dictionary Word of the Year. And it's not that, I mean, it's remarkable. And it's, if you were to hashtag me on Twitter and Instagram, you'll find 90 million self-portraits. And I had to check the statistic of people, because people are taking pictures of themselves. And, well, why? Like, what is it? You take that picture, you get that perfect angle. We talked about it a little bit earlier, and you sort of, you know, a little bit higher up with the right light behind you, you know, the bathroom mirror with that supernova flash so that you can get like that perfect glow. And then you put those filters on it and you post that on Instagram, and, which seems like an instant that took you an hour. And what are we looking for? Is it that validation? Is it self-reassurance? And I know I do it. I'm guilty that, you know, you look at the likes and people's comments and, oh, I should wear that shirt again because that was a winner. Yeah, people like that. And so it does. What is this, the function of what it's doing to us as individuals? Right. I noticed, you know, I have one of my children's 5 years old, and my older daughter taught her about Snapchat. I don't know if you know what that is, but I'm still trying to figure it out. Still, it makes me feel 100. But essentially, it's a modem or a medium where you can take a picture and post it, and it disappears almost as fast as you posted it. So my older daughter texted me back a picture of my 5-year-old sending her a selfie with the duck lips, and I was like, oh my, what is that? And it was so cute, like, it was so cute. But my worry was, what is going to happen? What's the future look like? How is she going to evolve into the woman she's going to be? And can I, who's guilty of the same thing, protect her from it? You know, I think we all are aware of the, is it Kendall Jenner or Kylie Jenner, one of those Kardashian beauties, that phenomena where she has clearly enhanced herself through one of these measures. And I'll say for sure she's done her lips. I mean, that's clear. I think I sent you a picture to show you that the timeline of her changes, and she looks amazing. She's a beautiful girl. All of them are remarkable looking, but you can literally timeline her entire life minute by minute on Instagram. Wow. There are thousands, not hundreds, thousands of pictures of her every single day posted, and you saw her transition like this. So she wonders why she's scrutinized so much. It's because people can see it.
Yeah.
I think the hard thing for me as a woman and as a mother and as the owner of a skin clinic where I promote exactly what she's doing is she's 17 years old.
Right.
And that worries me.
And the role models today are, I mean, for some young girls, they are the Kardashians,
for sure.
right? And I mean, we have some examples of their selfies because they are the selfie queens.
The selfie queens.
For sure. The queens of self-promotion, the queens of selfies. I mean, are we saying this is portraying them in a different light? Like, are they?
Some would say it's signs of a narcissistic time where how we look and how we are presenting ourselves is all about putting the perfect picture forward. And, you know, definitely I like to take care of myself and look the very, very best I can, but I don't want it to define me. And I wonder if the next generation of young ladies and gentlemen are going to be able to know the difference between building those relationships and seeing themselves how they're supposed to be.
Absolutely. Let's take a quick look. We have a couple of their selfies.
Yeah, well,
this is not so vain, is it?
No, it's not so vain, but it was just an impression that this was one of the most famous selfies. This selfie had beat a world record. It had over 2 million retweets on Twitter.
Wow.
And so Ellen, you know, she likes to make a joke of everything. She's one of my absolutely favorite comedians on TV, and she took that giant selfie, and everybody was super excited about it.
See, I love that selfie.
Love it.
Then we have selfies like this.
So we have Kim Kardashian, and again, she is beautiful. I mean, nobody could say that she isn't. However, what is that?
I'm not sure.
Like, I'm not sure what she's trying to say. Like, look at me, I look great after having a baby. Well, look at you, Jacqueline. You look amazing after having a baby, and you're not standing half naked in a mirror with your phone.
Right.
You know? Again, another Kim Kardashian picture of her husband in bed. You know, she looks spectacular, but we're living her life and how she wants us to see it.
Absolutely, and that's part of it as well.
Yes.
Maybe it's the facade, you know?
Well, is it the smoke? Is it smoke and
Smoke
mirrors?
and mirrors,
You know,
for
people
sure.
say I'd like to live the life I live on Facebook. So is this the real deal? But what it has opened up is younger women in their early 20s, which we've seen an onslaught of that in this last year, which we've never seen before, coming in for Botox and for filler.
More on that right after this break. Don't go anywhere. Welcome back to In the Know with my guest today, Shawn Solomon, owner of the Thornhill Skin Clinic. Thank you so much for being here today, Shawn.
Oh, my pleasure.
And we are talking now about looking your best and feeling your best. There's nothing wrong with that. We all want that.
Absolutely.
There are some great techniques and procedures that you can have done that are non-invasive.
Absolutely.
That can really help you.
I think the big question is that people come in and ask is, well, why are we doing this? Like, what's happening to our skin and how are we in fact aging? And I always say, I hate to be the bearer of bad news, my 20-year-old self, but it's happening now. And what's essentially happening is our skin cells stop turning themselves over. When we're young, from like 0 to 10 almost, I call that magic skin, because when our kids get a cut or a boo-boo or something, it almost seems to heal overnight, where when we get a little blemish or something, there seems to be a reminder of it for months, if not longer. And what's happening there? Our skin cells no longer turn themselves over like they once did naturally. And so with that, we build up dead skin, and our connective tissue, which is the strength and the stretch, otherwise known as elastin and collagen, start to break down. And essentially that's the beginning of our aging process. And you know that saying, if I knew then what I know now, couldn't it be so different? Because by manually manipulating those cells, we can keep happening what is supposed to be happening. And that's that cell renewal. And that term cell renewal, you'll hear me use all the time, because it is what in effect changes how the skin responds to the elements, right? We used to think that aging was just a given, that when we get old, that's just naturally we have to go that way. But it's not true. Science has proven that 10% is intrinsic and a factor of our culture or our ethnicity or our family life or the way we live our life, but 90% is photoaging. 90% is how the sun affects our skin. And what is happening with that is the UVB and the UVA deposit something called free radicals. We hear commercials for products that say, oh, starves off free radical damage. But what free radicals doing is they're stopping the production of your cells by 50%. We've already established that that's happening in our early 20s. So we are, layman, speeding up our aging process by 20%. Okay, so some of the different things that you can do, simplest, is exfoliate. And the premise of all cell renewal treatments is a form of exfoliation. And what does that really mean? So taking off those dead skin cells by maybe using a product with a little bit of a grit in it to exfoliate on younger skin, that's an excellent way to start. A treatment such as we're demonstrating today, such as microdermabrasion.
So this would be microdermabrasion.
This would be microdermabrasion.
At a professional level.
Exactly. And microdermabrasion is just gently exfoliating off the dead skin cells on the surface, exposing the epidermis. She's removing the stratum cornea, the dead layer of tissue that doesn't breathe any longer and nothing gets in and nothing gets out. And by doing that, she's not just exposing a more beautiful, brighter, smoother skin, she's also going to give you a better chance of penetrating with better product. So when you buy products from the store and you're like, this doesn't work, well, you're probably right. It's not working because it's not getting anywhere because it's sitting on the surface. So by offering a form of exfoliation, I'll bet, at home or in clinic, you can definitely change the way the skin is going to react intrinsically. And it turns into the fountain of youth. Because if we are manually manipulating those cells that are no longer turning over anymore, we are stopping the breakdown of our collagen and elastin. We do that young enough, we can actually get ahead of the game. Most people don't actually start bothering with their skincare until they notice a problem. That doesn't happen overnight, but we wake up at 40 and you look in the mirror like, what happened? And now we're treating, we're no longer preventing. And we had 20 years of time where we could have essentially move forward in a different way.
So prevention is key. You said, I mean, when do you know that you need a professional microdermabrasion as opposed to doing it at home a couple times a week?
Okay, so it's not when. I mean, I think the best way to get that answer is to go in for a consultation with a skincare professional and have somebody assess you and make some recommendation. However, microdermabrasion and low-grade peels, and we're also going to demonstrate that, are very sort of benign treatments that are very, very mild and safe for almost every skin type in almost every season.
Oh, great.
And so essentially turning over those dead skin cells and benefiting your cell renewal doesn't hurt you ever. You know,
it's only going to help.
It's only going to help.
Sure.
And, you know, like people think, oh, I don't want to have a peel because I saw that Sex and the City episode where Samantha's face was peeling off, and it's not the case. There are peels that are definitely stronger and they have purpose, and it is not necessarily for just cell renewal. They might be for resurfacing and different indications for much older skin. However, low-grade peels are considered lunchtime peels. We call them our red carpet peels.
Oh, I love that.
I had one the day of my wedding because you're brighter, your makeup will go on smoother. So the primary benefits that you're going to experience are actually secondary to those immediate sort of feel goods that you get from having a microdermabrasion or a low-grade glycolic peel. And for me, I like peels better than micro. Some people like micro better because I feel a peel, when they apply it to your face, it's applied evenly everywhere. So you're guaranteed all that dead skin removal, as opposed to it being driven by a technician.
So right now she's wiping the skin. Is she just cleansing the skin, or is that the peel?
She actually applied, she came in with clean skin, so she actually applied the peel. And this is a 30% unbuffered glycolic peel. So when it's applied to the skin, she's gonna feel a tingly reaction to the surface of her skin. And this is a neutralizing peel, so that means we can get it off as fast as we want, or leave it on a little bit longer, depending on the benefit. She will have no downtime. The skin may pinken up slightly, but she'll generally be very comfortable throughout the treatment. And after she's finished, she could go back to her daily life with no downtime. It sometimes can be a little bit of a letdown, because when people think peel or in-clinic treatment—
I was thinking something different.
Right. You think that it's going to be something that, oh, I have to go straight home, I have to take the weekend off. There are services that are like that, and every action creates a reaction, but these type of treatments are not. These are the kinds of things you want to have when you have an event coming up. You want to have when there's somewhere you want to look your best, but by doing them with some type of regularity, you're going to always look your best.
And that's the cell renewal, as you said, is one of the most important things.
And it's the basis of every single thing we do. If we go down the line of all of our skin therapy treatments, they're all doing one form of cell renewal or another. Even in anti-aging products, which we will get to, the generation change is all about more cell renewal and creating more action to thicker or thinner skin as we get older. So cell renewal is the key, and low-grade peels and microdermabrasion are definitely a very simple, cost-effective in-clinic treatment. Sort of, I would say, it can equate to when we were younger, we were told to have facials every 4 to 6 weeks, which did nothing. But that was the skin health ideal of the time. Well, microdermabrasion and low-grade peels are sort of today's generational skincare, and they're actually creating an action. The action has a purpose. And started young enough, you can prevent your aging process and protect yourself from doing the bigger
everybody.
treatments.
You heard it here on In the Know. We are going to take a very short break, and when we come back, aging in your 20s, 30s, 40s, and beyond. we're back with my guest, Shawn Solomon, here on In the Know, and we're talking about anti-aging and really having the best healthy skin that you possibly can through many decades today.
Right, absolutely.
Starting in our 20s, we learned that's the time to start paying attention.
I mean, we always want to take care of our skin. We take care of our children's skin. You know, we make sure they wear sunscreen even before ourselves. So, I mean, but historically, concern about the cosmetic appearance of the way we look goes back even to the Roman era. Back then, there were surgeons who were removing scars off soldiers' backs because the sign of a scar on their back meant that they had turned their back on the battle, or possibly that they'd been whipped. And so regardless of what our vanity might show the world, we've all been really conscious of it. So taking care of our skin or taking care of our facets is not a new thing.
It's not a new thing, yeah.
I think what is newer is how young people are starting, and they're starting in the wrong places, in my opinion.
Oh, okay.
Because a lot of people will come in, especially these young ladies that we talk about, and they'll come in their early 20s and they want Botox to prevent fine lines and wrinkles, which not entirely unreasonable depending on the case, or they might want to enhance their lips, which again is a personal choice. You know, whether I appreciate it or not is irrelevant.
Sure.
However, it's like building a house on a broken foundation. Right? So if we redecorate the whole house and then the foundation cracks, well, all those decorations aren't going to go very far.
Right.
And it's our skin that's holding everything up. I mean, we have our deep layer connective tissue, which is where our sagging and our dropping will occur as we get older. We have our superficial connective tissue, where our fine lines and wrinkles start to show, static lines, folds, and loss in volume. And again, going back to the conversation of cell renewal, which I always will, and it might get boring, but I will plow it in, is how do we stop all of those things from happening? So in our 20s is probably the ideal point. If I could go back and do things differently, believe me, I would have. And one of the biggest things I would have done then is stayed the heck out of the sun.
Oh.
Sunscreen 365 days of the year. The girls at my clinic hear me say this all the time. I'm sure they're bored of hearing it. But I always say sunscreen and eye cream are my religion, because they're the two things that are preventative and proactive in treating aging, especially in things that can't always, they might be able to be treated and they may look better, but they can't always be fixed, particularly under the eyes.
Okay.
Okay, so starting in our 20s, we really, really want to get into deep moisturizing, mild exfoliation, very good cleansing and cleaning to our skin, toning for pH balance, and wearing our sunscreen. No more sun tanning, no more looking at the sun to get color, because the color that your skin is supposed to be is the color that you see when you're not in the sun.
Exactly.
Right? So, and we know
that
now,
has to change socially, I think, right? I mean,
I think
we all feel great with the tan.
You know what? I
but
think
now
it
there
is.
are other ways to
there are other ways,
way.
and makeup is one great thing that females have over males, but I think that it is changing, because I know myself. I mean, I was a sun worshiper growing up, I can't lie, but as soon as I understood the difference, and you know, you put it in line with what's important to you, right? So I think people are staying out of the sun more and more. It should be a skin health conversation. It generally isn't.
Absolutely.
But you know, we are on the rise with skin cancers now more than ever before, and protect and prevent is, you know, key words in skin cancer and melanoma protection. And we don't want to find out the hard way, and people are getting it younger and younger. But if the vanity benefit inspires you more, then all the power. Wear your sunscreen, you know?
So 20s sounds fairly simple.
Yeah,
so
and inexpensive.
After you've gone through your 20s, and we did have a picture of Ariana Grande.
Yes, Ariana
20s
Grande.
picture is coming up.
Yeah.
Now, obviously, this is like you're in your prime.
Right.
It's a pretty easy time to take care of your skin.
It really is. I mean, the light reflects off of 20-year-old skin like nothing. They have, it's still in the magic skin, because she still has some cell renewal. So if she was promoting what she already has, she's ahead of the game.
Okay.
And that is the only time she's going to be able to do that.
And let's take a look at the 30s. 30s are when things start to kind of really change.
Definitely. 30s are when everything starts to change.
Yeah.
This is the time when we start to notice our skin gets a little bit drier. We start to see fine lines and wrinkles, some sunspots, dark spots. Vascularity or rosacea becomes a culprit for a lot of women. Changes in your tone, your texture, and mild volume loss.
Okay.
Okay, so going in, hopefully we went into our 30s gracefully by taking good care of our skin. How are we upping the game now, right?
Okay.
So we are now increasing our use of cell renewal products. And one thing that is intrinsic between 30s all the way up to the 70s is retinols or vitamin A's.
Okay.
So bringing those into play now is a really important factor. And you can bring in milder ones in your 30s, stuff that maybe doesn't necessarily create any type of downtime and or doesn't create sensitivities to the skin like some retinols can. like a Daily Power Defense by Zeo is one of my favorite products because it's a 0.5 retinol. It can be applied to the skin as your daily moisturizer, and you won't even know you're doing something good for yourself.
So it's very gentle, topical.
Very, very gentle. You can use it every day, and it will give you the moisture that you need to get through the day, to put makeup on top of, but it's actually acting for you. There's also some retinol products like Brightenex is one that I like because it helps with brown spots. So if you're starting to experience different things, like brown spots or sun damage, it can help with the melanocyte production.
Okay. Can we mention 40s? Because we don't want to leave out the 40s.
30s to 40s is in a very similar time. I mean, all we're doing is we're increasing in the same problems that we were having previously, right? So we're increasing in volume loss. We're seeing more wrinkles as opposed to just fine lines. And I'm not, you know, we do promote using Botox for prevention, and filler is a wonderful thing as long as it's being used to give you back some of the things that you've lost, not replacing things you never had.
Right.
And that's where there's some issues with some of the things that we might see with movie stars and different people doing things to their face. There is a place to look very natural with the help that we have available. It's just using it properly. So in our 40s, I mean, I'm in my 40s, so, you know, I'm right there with you. Not with you, but with 40 skincare. And in our 40s, we really want to be proactive in our skin. Now we need to be in the clinic more. We need to be doing more forms of cell renewal because at home, light exfoliation isn't going to take off enough dead skin to create the penetration of the products that we really need to get in. So this is when you're submitting to photofacials, which is a light-based treatment for sun damage. It helps to remove actinic keratosis, any precancerous cells that could be developing from years of exposure. It'll remove the fine lines and the veins and little broken capillaries in the skin, as well as it's usually when most people in their late 30s and 40s start to wake up and be like, wow, when did that happen?
I need a little makeover.
And that's when most people are starting to really become serious about having Botox. I mean, Botox was last year the #1 non-surgical cosmetic procedure provided. And the statistics showed, I think there was something like 4 billion procedures provided, as opposed to...
So it is really something that people are jumping on with and staying. And thank you so much,
It is the most common thing.
We could talk all day. We really could. Thanks for watching In the Know here on Rogers TV. Don't forget to visit our website, rogerstv.com. And for more details on Shawn, where do we go?
You can go to www.thornhillskinclinic.com. And we're also located at 7787 Yonge Street.
Thank you so much. We'll see you next time. With all the creams, lotions, and potions available on the market today, anti-aging can be a confusing and overwhelming topic. This week on In the Know, we'll sit down with our guest expert, Shawn Solomon of the Thornhill Skin Clinic. She'll be talking about some of the lesser-known anti-aging tips for your 20s, 30s, and 40s. That's In the Know, Thursdays at 6 p.m., only on Rogers TV.